100 important questions in Anatomy and Physiology Part 2 Questions and Answers. You have 5 seconds to answer each question. Questions 1 to 25 were already presented in a previous video labeled Part 1. Are you ready? It is an odontogenic developmental anomaly in the occlusal surfaces of premolars in the form of a tubercle of enamel with an extension of the pop horn. A. Leon's premolar, B. Talon's cusp, C. Pink tooth of mammary, D. Hutchinson's tooth. Answer A. Leon's premolar. This is a thin layer composed of glycoproteins from saliva which forms on the surface of teeth seconds after chewing or after the teeth is clean. A. Lysosome, B. Lysozyme, C. Dental pellicle, D. Desmosome. Answer C. Dental pellicle. This duct drains saliva from the parotid gland into the mouth at the area of the upper cheeks. A. Wharton's duct, B. Duct of Rivinus, C. Stenson's duct, D. Submandibular duct. Answer C. Stenson's duct. This duct drains saliva from the bilateral submandibular gland and sublingual gland to the sublingual caruncle at the base of the tongue. A. Wharton's duct, C. Duct of Rivinus, C. Stenson's duct, D. Bartholin's duct. Answer A. Wharton's duct. These are numerous small ducts from the sublingual gland and opens to the floor of the mouth. A. Duct of Rivinus, B. Bartholin's duct, C. Stenson's duct, D. Wharton's duct. Answer A. Duct of Rivinus. The major duct of the sublingual salivary gland is A. Bartholin's duct, B. Stenson's duct, C. Wharton's duct, D. Duct of Rivinus. Answer A. Bartholin's duct. Which is not a secretion of the adrenal medulla? A. Somatostatin, B. Epinephrine, C. Norepinephrine, D. Sex hormones. Answer D. Sex hormones. The development of a cartilaginous union between two bones, like the joint between the sphenoid and occipital bone at the base of the skull, is called A. Syndesmosis, B. Synchondrosis, C. Synostosis, D. Synarthrosis. Answer B. Synchondrosis. The breakdown of glucose to extract energy for cellular metabolism is called A. Glycolysis, B. Glycogenolysis, C. Gluconeogenesis, D. Glyceroneogenesis. Answer A. Glycolysis. The causative microorganism for dental caries is A. Lactobacillus acidophilus, B. Streptococcus salivarius, C. Streptococcus mutans, D. Streptococcus viridans. Answer C. Streptococcus mutans. Epinephrine is a secretion of the A. Zona glomerulosa, B. Zona fasciculata, C. Zona reticularis, D. Adrenal medulla. Answer D. Adrenal medulla. It is a naturally occurring enzyme found in body secretions like sweat, saliva, and tears, and has an antimicrobial property by cleaving the peptidoglycan components of bacterial cell walls, which leads to cell death. A. Lysosome, B. Lysozyme, C. Proteoglycans, D. Macrophage. Answer B. Lysozyme. Which vitamin is essential for liver synthesis of prothrombin complex clotting factors? A. Vitamin A, B. Vitamin D, C. Vitamin E, D. Vitamin K. Answer D. Vitamin K. The olfactory nerve is the A. First cranial nerve, B. Second cranial nerve, C. Fifth cranial nerve, D. Seventh cranial nerve. Answer A. First cranial nerve. The epidermis has these main types of cells except A. Melanocytes, B. Keratinocytes, C. Langerhans cells, D. Phagocytes. Answer D. Phagocytes. The sphenomandibular ligament is a flat, thin band which originates superiorly from the spine of the sphenoid bone and attaches to the A. Styloid process of the temporal bone, B. Lingula of the mandibular foramen, C. Coronoid process of the mandible, D. Condylar process of the mandible. Answer B. Lingula of the mandibular foramen. A hormone produced and secreted by the anterior pituitary gland is A. ACTH, B. Oxytocin, C. Antidiuretic hormone, D. Insulin. Answer A. ACTH. C cells in the thyroid gland produce this hormone: A. Calcitonin, B. T3, C. T4, D. TRH. Answer A. Calcitonin. Which of the following anticoagulants is not naturally occurring? A. Heparin, B. Protein C, C. Antithrombin, D. Coumadin. Answer D. Coumadin. It is the most common antibody and protects against bacteria, viruses, and bacterial toxins. A. IgM, B. IgA, C. IgG, D. IgE. Answer C. IgG. C1 is commonly referred to as A. Atlas, B. Axis, C. Lamina, D. Pedicle. Answer A. Atlas. The protein inside red blood cells that carries oxygen to the cells and carbon dioxide to the lungs is the A. Mitochondria, B. Hemoglobin, C. Plasma, D. Rh factor. Answer B. Hemoglobin. How many chromosomes are in a male gamete? A. 23, B. 23 pairs, C. 46, D. 46 pairs. Answer A. 23. What chromosomes are there in a male gamete? A. X only, B. X and Y, C. X or Y, D. Y only. Answer B. X and Y. The pulp of the mandibular first premolar is from the A. Inferior alveolar nerve, B. Lingual nerve, C. Incisive nerve, D. Mental nerve. Answer A. Inferior alveolar nerve. The cribriform plate, which contains various holes where Volkmann canals pass from the alveolar bone and into the periodontal ligament, is found in A. Alveolar bone proper, B. Lingula of the mandible, C. Condyloid process of the mandible, D. Coronoid process of the mandible. Answer A. Alveolar bone proper. Granular layer of tomes, which are hypocalcified areas, are found in A. Enamel, B. CEJ, C. Root dentin, D. Pulp. Answer C. Root dentin. Which of the following muscles of mastication is attached to the coronoid process of the mandible? A. Buccinator, B. Temporalis, C. Masseter, D. Lateral pterygoid. Answer B. Temporalis. The main organic compound that makes up dentin is A. Desmosomes, B. Fibronectin, C. Collagen, D. Hydroxyapatite crystals. Answer C. Collagen. It is a small fluid-filled sac lined by a synovial membrane that provides cushion between bones and tendons or muscles around the joint. A. Symphysis, B. Bursae, C. Suture, D. Synchondrosis. Answer B. Bursae. It is the most common type of cell found in connective tissue and secretes collagen proteins that are used to maintain a structural framework for many tissues. A. Osteoblast, B. Osteocyte, C. Fibroblast, D. Fibroclast. Answer C. Fibroblast. The cusp of Carabelli is a small additional cusp at the mesopalatal line angle of A. Maxillary first molars, B. Mandibular first molars, C. Maxillary second molars, D. Mandibular second molars. Answer A. Maxillary first molars. The ground substance in blood is called A. Red blood cells, B. White blood cells, C. Platelets, D. Plasma. Answer D. Plasma. The depressed part of the interdental papilla is called A. Sulcus, B. Margin, C. Caul, D. Stippling. Answer C. Caul. Which vitamin is essential for maintaining the health of epithelial cells throughout the body? A. Vitamin D, B. Vitamin E, C. Vitamin K, D. Vitamin A. Answer D. Vitamin A. The fundamental functional unit of most compact bone is the A. Osteoblast, B. Osteocyte, C. Osteoclast, D. Osteon. Answer D. Osteon. The part of the gingiva which attaches the connective tissue to the tooth surface is the A. Junctional epithelium, B. Sulcular epithelium, C. Oral epithelium, D. Marginal gingiva. Answer A. Junctional epithelium. This structure is a fibrous extension that runs between the two articular surfaces of the TMJ, dividing the TMJ capsule into an upper and lower compartment. A. Articular tubercle, B. Articular disc, C. Mandibular fossa, D. Mandibular head. Answer B. Articular disc. This hormone, which regulates reabsorption of water into the blood, is secreted by the posterior pituitary gland. A. Vasopressin or antidiuretic hormone, B. Prolactin, C. Growth hormone, D. ACTH. Answer A. Vasopressin or antidiuretic hormone. This hormone, which causes breast milk to be produced during childbirth, is secreted by the anterior pituitary gland. A. Vasopressin or antidiuretic hormone, B. Prolactin, C. Growth hormone, D. ACTH. Answer B. Prolactin. The alpha cells in the islets of Langerhans secrete A. Insulin, B. Somatostatin, C. Pancreatic polypeptide, D. Glucagon. Answer D. Glucagon. The parotid duct or Stensen's duct traverses this muscle to open into the mouth at the area of the upper cheeks. A. Masseter, B. Lateral pterygoid, C. Temporalis, D. Buccinator. Answer D. Buccinator. The junction between primary and secondary dentin is A. A reduction in the number of tubules, B. Sharp curvature, C. A resting line, D. A change in the direction of the dentinal tubules. Answer D. A change in the direction of dentinal tubules. The mandible developed from this branchial arch. A. First branchial arch, B. Second branchial arch, C. Third branchial arch, D. Sixth branchial arch. Answer A. First branchial arch. The cells which form cementum are called A. Cementocytes, B. Cementoclasts, C. Cementoblasts, D. Osteoblasts. Answer C. Cementoblasts. This is a calcified dental tissue that do not contain cells or part of cells within it. A. Enamel, B. Dentin, C. Pulp, D. Periodontal ligament. Answer A. Enamel. The dental follicle or dental papilla differentiates into A. Periodontal ligament, B. Enamel, C. Dentin, D. Pulp. Answer: A. Periodontal ligament. Occipital is a connective tissue fiber found in A. Periodontal ligament, B. Enamel, C. Dentin, D. Pulp. Answer: A. Periodontal ligament. Heparin is a naturally occurring glycosaminoglycan which is produced by A. Leukocytes, B. Neutrophils, C. Basophils, D. Platelets. Answer: C. Basophils. Which is the most abundant white blood cell in the circulation? A. Eosinophils, B. Basophils, C. Monocytes, D. Neutrophils. Answer: D. Neutrophils. This blood type has the lowest risk of causing serious reactions for most people who receive it. It is the universal blood donor type. A. Type A, B. Type B, C. Type AB, D. Type O. Answer: D. Type O. In the facial surface, the demarcation between the free gingiva and the attached gingiva is the A. Free gingival groove, B. Mucogingival junction, C. Interdental papilla, D. Gingival sulcus. Answer: A. Free gingival groove. Which tooth is more likely to exhibit a lingual groove from the crown to the root? A. Maxillary first molar, B. Maxillary central incisor, C. Maxillary lateral incisor, D. Mandibular first molar. Answer: C. Maxillary lateral incisor. These cells play a role in touch perception. A. Merkel cells, B. Langerhans cells, C. Thrombocytes, D. Neutrophils. Answer: A. Merkel cells. The ions that regulate nerve impulses in the body: A. Calcium and sodium, B. Sodium and potassium, C. Potassium and phosphorus, D. Calcium and fluoride. Answer: B. Sodium and potassium. What type of joint is between the sphenoid and the occipital bones at the base of the cranium? A. Diarthrosis, B. Syndesmosis, C. Amphiarthrosis, D. Synchondrosis. Answer: D. Synchondrosis. These are spot-like specialized adhesive protein complexes that localize to intercellular junctions which connect epithelial cells together. A. Adhering junctions, B. Occluding junctions, C. Gap junctions, D. Desmosomes. Answer: D. Desmosomes. The smallest bone in the human body is the A. Femur, B. Stapes, C. Incus, D. Malleus. Answer: B. Stapes. It is a horseshoe-shaped bone that does not form a joint with any other bones of the head and neck. A. Hyoid bone, B. Incus, C. Malleus, D. Stapes. Answer: A. Hyoid bone. Among all four muscles of mastication, this is the only muscle that depresses the mandible. A. Masseter, B. Temporalis, C. Medial pterygoid, D. Lateral pterygoid. Answer: D. Lateral pterygoid. The motor innervation of the buccinator muscle is from the A. buccal branch of the facial nerve, B. trigeminal nerve, C. inferior alveolar nerve, D. long buccal nerve. Answer: A. buccal branch of the facial nerve. It is a thin membrane of tissue produced by a melloblast that covers the tooth once it has erupted. A. dental pellicle, B. Nasmyth's membrane, C. periodontal membrane, D. barrier membrane. Answer: B. Nasmyth's membrane. The interface of enamel and dentine in the dentino-enamel junction is scalloped or wavy in outline, with the convexity of the waves A. towards enamel, B. towards cementum, C. towards dentine, D. towards apically. Answer: C. towards dentine. Which of these muscles of mastication originate from the zygomatic arch? A. masseter, B. medial pterygoid, C. lateral pterygoid, D. temporalis. Answer: A. masseter. At this pH, enamel demineralizes. A6, B7, C7.5, D5.5. Answer: D5.5. Which cranial nerve passes through the foramen lacerum? A. facial nerve, B. greater petrosal nerve, C. vagus nerve, D. glossopharyngeal nerve. Answer: B. greater petrosal nerve. Excessive intake of fluoride during enamel development causes A. hypercalcification of enamel, B. hypomineralized enamel, C. stronger enamel, D. multiple teeth formation. Answer: B. hypomineralized enamel. Epithelial cells are attached to the basal lamina by A. desmosomes, B. hemidesmosomes, C. attached junctions, D. fibronectin. Answer: B. hemidesmosomes. The dentogingival junction, which is the junction between the tooth surface and the gingival tissue, is derived from A. dental follicle, B. dental sac, C. dental papilla, D. reduced enamel epithelium. Answer: D. reduced enamel epithelium. Perikymata are incremental growth lines that appear on the surface of the tooth enamel as a manifestation of A. enamel tufts, B. striae of reticules, C. cracks, D. prismless enamel. Answer: B. striae of reticules. The mandibular nerve, which is the largest of the three divisions of the trigeminal nerve, exits the cranium through the A. foramen lacerum, B. foramen ovale, C. foramen spinosum, D. foramen rotundum. Answer: B. foramen ovale. The lingula of the mandible is the attachment of which ligament? A. sphenomandibular, B. stylomandibular, C. lateral ligament, D. capsule. Answer: A. sphenomandibular. This papillae is thin and wire-shaped, is the most numerous of the lingual papillae but has no taste buds. A. foliate, B. circumvallate, C. fungiform, D. filiform. Answer: D. filiform. It is a groove or cavity usually containing osteoclasts that occur in bone which is undergoing resorption. A. matrix, B. Howship's lacuna, C. canaliculi, D. ruffled border. Answer: B. Howship's lacuna. These are nitrogenous bases in a DNA except A. Adenine, B. uracil, C. cytosine, D. guanine. Answer B. uracil. For more Q&As, don't forget to like and subscribe. Thanks for watching!